The brain is one of the most highly perfused organ of the body. It constitutes only 2% of the body weight, yet it receives 15 to 20% of the cardiac output. Why do you think so? It's because the brain has a high metabolic demand for oxygen and glucose. Within 10 seconds of reduced blood flow to the brain, the consciousness is lost within 10 seconds. And if it continues, the irreversible brain damage starts at 4 minutes, and this gets completed at 10 minutes. So now, let us start with the blood supply of the brain. The arterial supply of the brain can be divided into two parts, the anterior circulation and the posterior circulation. The anterior circulation is mainly by the carotid system, while the posterior circulation is by the vertebrobasilar system. So the carotid and the vertebral arteries, they rise in the neck and ascend to the cranium. Within the cranium vault, the terminal branches of these arteries form an anastomotic circle called the circle of Willis. From this circle, branches arise which supply the majority of the cerebrum. Now, let us study about the posterior circulation. The posterior circulation is comprised of the vertebral artery, which is a branch of subclavian artery. It ascends in the foramina transversalia of upper 6 cervical vertebra. On reaching the base of skull, it winds backwards and pierces the posterior atlanto-occipital membrane, enters the posterior cranial fossa to the foramen magnum. The two vertebral arteries then unite at the lower border of pons at the pontomedullary junction to form a basilar artery, which flows over the dorsal surface of pons to give two terminal branches called the posterior cerebral artery. The branches of the cranial part of the vertebral artery are: number 1, anterior spinal artery, which unites with its fellow of opposite side to form a single median trunk which descends along the anterior longitudinal fissure. A second artery is posterior inferior cerebellar artery. This branch of cranial part of vertebral artery is the largest branch. It supplies the posterior part of cerebellum and the lateral part of spawn. Now, when we see a cross section of the spinal cord, we see that the anterior 2/3 of the spinal cord is supplied by the anterior spinal artery, while the posterior 1/3 of the spinal cord is supplied by the posterior spinal artery, which is also a branch of the vertebral artery. There are some small, multiple branches of cranial part of vertebral artery known as the segmental arteries, which assist in supplying the blood along with the anterior spinal artery. Few other small branches are meningeal branches and the medullary branches. Now let us see the branches of the basilar artery. One such branch arising from basilar artery is the anterior inferior cerebellar artery. It supplies the anterior and inferior part of the cerebellum along with the lateral part of pons. Another branch of the basilar artery, which accompanies the vestibulocochlear nerve, enters the internal acoustic meatus, is the labyrinthine artery. It is an end artery. It also gives some numerous slender pyramidian vessels which pierce the pons to supplies. As the name says, these are the pontine branches. One more branch of the basilar artery is the superior cerebellar artery. As the name suggests, it supplies the superior surface of the cerebellum. Now let us study about the anterior circulation or the carotid system. The internal carotid artery, which is the terminal branch of common carotid artery, which divides at the level of C4 vertebra, it traverses the carotid canal in the base of skull, enters the middle cranial fossa, passes anterior to cavernous sinus to enter the subarachnoid space. To see the branches of the internal carotid artery, the first one is ophthalmic artery, which supplies the structure of the orbit including the eyeball by its branch called retinal artery. The other branch is the posterior communicating artery, which runs backwards and anastomoses with the proximal part of posterior cerebral artery. It also participates in the circle of Willis formation. Another branch is the anterior choroidal artery. This artery has a long subarachnoid course and a relatively short lumen. Therefore, it is most susceptible to thrombosis. Thus, it is also referred to as artery of cerebral thrombosis. The terminal branches of the internal carotid artery in brain are anterior and middle cerebral artery. The anterior cerebral artery is a smaller terminal branch, while middle cerebral artery, it carries about 30% of the carotid blood flow. Now, let us see what happens with the terminal branches of these two arterial systems by looking at the base of the brain. These are the two anterior cerebral arteries, which are the branches of the internal carotid artery. They are communicated with the help of the anterior communicating artery. This is the internal carotid artery. This is located just proximal to the middle cerebral artery. These are the two posterior communicating arteries. The middle cerebral artery is one of the terminal branches of the internal carotid arteries, and these are the two posterior cerebral arteries, which are the terminal branches of the vertebral arteries. Now, as we see, These are the terminal branches of the anterior circulation and the posterior circulations, which we have studied just now. So there's an interconnection between these terminal branches. This is the anterior communicating artery, anterior cerebral artery, internal carotid artery, posterior communicating artery, and the posterior cerebral artery. And along with these, the same arteries from the opposite side form an interconnection with each other, which is known as the circle of Willis, which is the anastomotic circle present at the base of the brain. Now let us study about the venous drainage of brain. It can be divided into two parts, the external or superficial cerebral veins and the deep cerebral veins. The external or superficial cerebral veins are comprised of the superior cerebral vein, the middle cerebral vein, and the inferior cerebral vein. While the deep cerebral veins include the septal, thalamostoid, and choroidal veins, there are some features which are unique to the venous drainage of the brain. They are: the venous return of the brain uniquely does not follow the arterial pattern. These veins are extremely thin-walled because of the absence of the muscular tissue in their walls. These veins do not have valves, that is, they are valveless veins, and these veins they run mainly in the subarachnoid space. The diagram on the left shows the lateral aspect of the brain, while the diagram on the right shows the inferior aspect of the brain. This vein, which is known as the superior cerebral vein, drains the major part of the cerebral cortex. It is located on the superior surface of the lateral surface of the cortex. Another vein, which is known as the superficial middle cerebral vein, this vein is located in the lateral surface of the lateral surface of the brain. The third vein, which interconnects the superficial middle cerebral vein with the superior sagittal sinus, is known as the superior anastomotic vein of Proulard, and another vein, which interconnects the superficial middle cerebral vein with the transverse sinus, is known as the inferior anastomotic vein of Labbé. The blood from these veins then drain into the transverse sinus. Then the blood from the transverse sinus drains into the sigmoid sinus. Finally, the blood then drains into the internal jugular vein. Now let us see some important veins as seen from the base of the brain. One of the important veins is the anterior cerebral vein, which drains some part of the anterior part of the brain. Another two veins are the deep middle cerebral vein and the striate veins. When these three veins join together, they form an important vein which is known as the basal vein of Rosenthal. The basal vein of Rosenthal then drains into the great cerebral vein of Galen. Now let us have a look at the clinical significance about all what we have learned till now. So this structure, as you must have recognized, is the circle of Willis. So one of the pathologies of the circle of Willis is the presence of aneurysm or aneurysm formation. So an aneurysm, it is defined as the increase in the diameter of the artery by more than 50% of its normal. It is basically due to the absence of tunica media and the vessel wall. As seen that the aneurysms are mainly formed in the circle of Willis arteries. They are formed at the junction of the two arteries. As seen, 40% of the Berry's aneurysm, they are seen at the junction of the anterior cerebral artery and the anterior communicating artery. These aneurysms can become dangerous once they rupture, leading to the formation of hemorrhage. So when these arteries rupture, they form subarachnoid hemorrhage, which, if untreated, is dangerous. Thus, this makes it important to know about the aneurysms. Another clinical significance to know the blood supply of the brain is to help in the localization of lesion during the development of stroke or what is known as the cerebrovascular accident. The stroke which can occur, it can be due to the thrombosis in one of the arterial system, or it can also be due to embolism due to the rupture of thrombosis. It can also be due to ischemia, and it can also be due to the hemorrhage which can occur due to the rupture of aneurysm or any other reasons. This stroke which is seen can be localized as occurring due to the anterior cerebral artery or the middle cerebral artery or the posterior cerebral arteries, which are the terminal branches. So, the anterior cerebral artery stroke is seen to be having contralateral hemiparesis, ability to identify objects correctly, and apathy and personality changes due to the damage to the frontal lobe. The middle cerebral artery stroke is seen to be having contralateral hemiplegia, aphasia, and contralateral homonymous hemianopia. And finally, the posterior cerebral artery stroke is seen to be having majorly contralateral homonymous hemianopia with macula sparing as one of its most salient features.